Assalamu alaikum. I am Dr. Bulbul Hossain Shuvo, Assistant Professor, Department of Community Medicine. Today I am going to deliver a topics on occupational health. In 1950, both joint of ILO and WHO committee has given a definition on occupational health. Objective of occupational health: to maintain and promote the physical, mental and social well-being of the workers, to prevent occupational disease and injuries, to adapt the workplace and work environment to the needs of the workers of ergonomics principle. It should be preventive rather than curative. Here we have used a term that is ergonomics. Now we are going to know what is ergonomics. Ergonomics is derived from a Greek word ergon, that means work, and nomos, that means law. It is simply meaning that fitting the job to the worker. The objective of ergonomics is to achieve the best mutual adjustment of the man and his workplace. Now, occupational environment. Basically, three types of interaction in working at occupational environment. If we know and if we want to make this simple, that is MAM, M-A-M. What is the meaning of M-A-M? M for machine, A for agent, A for man. That means first interaction man with man, second interaction man with agent, and third interaction man with machine. Occupational diseases. Here there are many types of occupational diseases or hazard. Physical, and that is caused by physical hazard, biological hazard, chemical hazard, mechanical hazard and psychological hazard. Firstly, we want to know about physical hazard. Just like pressure, here by pressure it can be occurred caisson disease or blast, cold, tense foot, frostbite, light, occupational cataract and minor nystagmus, heat, heat syncope, heat cramps, prickly heat, electricity, burn, noise, occupational deafness, mechanical, injuries and accident. Radiation. For radiation it can be occurred cancer, aplastic anemia, leukemia. Now, chemical hazard. By chemical agent like benzene, chloroform, chemical agent, acid, alkyl, pesticide, it can be produce various type of hazard like local action, dermatitis, eczema, ulcer, etc. Biological hazard, anthrax, tetanus. Mechanical injuries. Psychological hazard, here anxiety and depression and including hypertension. Just like if I do not like this type of environment to work, I do not feel better, that it will create anxiety and depression. Pneumoconiosis. Pneumoconiosis is important part in occupational health. Dust-borne disease where dust particles range is 0.5 to 3 microns. This type of dust is creating pneumoconiosis. Here has a cardinal feature of pneumoconiosis. Firstly, lung involvement, chronic exposure and irreversible lung disease. This is non-communicable disease. It can be prevented by dust control, personal protection and periodical medical examination. Here, if this is so much important topics for occupational health, disease caused by dust or pneumoconiosis can be divided two ways: inorganic and organic. Inorganic, if we simply numeric, that has the Ka-Shi. Ka-Shi means C for coal, anthracosis, asbestos, asbestosis, S, silica, silicosis, and iron, siderosis. Organic, here also has a simply numeric, that is CCTH. C for can fiber, bagasosis, cotton dust, bicyanosis or bicinosis, tobacco, tobacosis, hay or grain dust. Previously we have discussed, that is known as pneumoconiosis, part of farmers' lungs. Now we are going to know about farmers' lungs. Farmers' lungs is due to inhalation of mildly hay or grain dust, and the pathological changes for farmers' lungs, that is pulmonary fibrosis, irreversible pulmonary disease and cholpulmonary. Clinical features should be dry cough, breathlessness without wheeze, headache, fever, malaise and muscle pain. Now, farmers' lung can be prevented by dry coughs before storage, work in ventilated areas or outside, wet down dusty areas prior to working in that environment, weight should be inside, and K, stopping mouth growth. Consider respirator. Now, this is also so much important topics for occupational health. That means occupational health risk for health workers, just like doctors, nurse and medical personnel, our student, that can be affected this type of disease. Now we are going to discuss on occupational health risk for health workers. Here has also simply presented by RBCMP. I am again telling that RBCMP. R means radiation, leukemia, cancer, sterility, ulceration. B, biological hazard. It can be affected with hepatitis B, C, COVID-19, AIDS. C, chemical exposure, just like burn and addiction to anesthetic gas. MP, M means mechanical injury. It can be when you are going to doing a performance of operation theater, a OT, then you can be pricking by any needle, that is pricking of finger by needle, back pain. You are standing a long time on a OT or giving lecture or doing a long case by standing, that time you are facing back pain. Now we are finishing our today's topics. Thank you. We will discuss our second part later. Thank you.